Even though COVID-19 is still a relatively new disease, we do know that certain patient groups have higher risk for contracting the disease and having more severe disease if they get it. I think chronic diseases such as chronic lung disease, heart disease, kidney disease, cancer, obesity, immunosuppression are some of the major groups. Now, obviously, a lot of those you can't really do much about. However, there are certain behaviors that can also lead to higher risk. One of the biggest risk behaviors is smoking. Whether traditional smoking or vaping has the potential of creating a lot of inflammation in the lung, decreasing the immune response, and leading to acute as well as more chronic lung disease, making smokers more susceptible to contracting COVID and also more likely to develop more severe disease if they get COVID-19. I think some of the behaviors and measures we can all take include better nutrition, limiting stress, better sleep, and certainly things such as avoiding alcohol use and tobacco use. We know that both tobacco and vaping have a potential of decreasing the immune response the body will put up to fight diseases such as COVID. We know from other diseases such as the flu that the smokers are twice as likely to contract those respiratory diseases. So certainly taking some of those measures and quitting smoking would be an important step. Now, I know from many patients that try to quit smoking that it can be very stressful when you try to do that. And certainly in this time of a pandemic, that stress is even higher. There are many resources, however, that can help people who try to quit. Certainly you can talk to your healthcare provider, but there are also some other resources that the state can provide, helplines that you can reach out to. And again, other things such as meditation and good health habits will be very helpful. I understand this is a very difficult thing sometimes, but we're here to help you. So one question that frequently comes up has to do with secondhand smoking, both general health effects, but in particular COVID. And it's pretty clear that secondhand smoking has significant health effects to the patients who are exposed to it. Even though we don't know specifically about COVID, how that affects the chance of getting COVID and severe disease, it is very likely that secondhand smoking increases the chances of having an adverse effect after contracting COVID. I think this is one of the things that we as society can try to do to help people fight the pandemic. And this time, when a lot of the businesses are closed or they're about to reopen, I think there's an opportunity there to try to enforce smoke-free environments. This is very important both for the people who work there, but also for the patrons who visit. And certainly this is something that's very responsible social behavior to try and protect our fellow citizens from the effects of secondhand smoking. We are learning a lot about COVID-19 and vaping, and this is a behavior that's primarily exhibited by younger people. Sometimes it's easy to think that young people are invincible and perhaps resistant to COVID, and that couldn't be further from the truth. Some recent data show that people who vape are probably about twice as likely to get COVID compared to those who don't. And we also have to think that vaping by itself can cause acute lung disease, which in some aspects is very similar to what COVID does. So it's very reasonable to assume that if a vapor gets COVID, there is a very high chance that they will develop a severe lung disease. So I would definitely recommend that people either stop vaping along with stop smoking, or certainly not try to pick it up now during the time of a pandemic. One thing that I would like to point out about COVID-19 is that nobody is immune to it. Regardless of age or health, comorbidities, health habits, I think we're all at risk of contracting that disease. And therefore, both for ourselves but also for our loved ones, it's imperative that we adhere to the social distancing measures, wear a mask and avoid behaviors that can increase our risk of getting it, such as smoking and of course unhealthy nutrition and other health measures. So it's a disease that all of us can get, and it's imperative that we pay attention to try to avoid it.